Uneven nasolabial folds. How is this problem corrected? I recently had 2 syringes of Juvederm placed in my nasolabial folds and into my lips. I've always been told that one side of my face is wider than the other. Every time I get filler in my folds, they look uneven. How is this problem corrected? Do I need more fillers in my cheeks? Had radius back in February.
Thank you for your question. You stated in your question, which you submitted with the photo, that you had 2 syringes of Juvederm placed in the nasolabial folds and the lips. And you're concerned that the nasolabial folds tend to be uneven even after placement of filler. And you've been told that one side of your face is wider than the other. You're asking about how this may be dealt with in the moving forward. Well, I can certainly give you my perspective as a specialist. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I do a lot of injectable fillers for mostly facial age-related changes, and I use Juvederm as well as other fillers to help people with this. But I think that in a situation like yours, I'm going to be able to share with you how I explain to people what the nasolabial folds are relative to the global issue with the facial asymmetry. So, to begin with, you are certainly on the right track. It is very well known in our field that one side of the face is not the same as the other side of the face. There's always one side that's a little bit more recessed. Maybe sometimes it can be a little bit wider, a little bit different, but there's natural asymmetry. But another important factor, and that asymmetry is based on, going back to that concept, it's based on bone structure, bone, muscle, fat. Everything is like the bone is all, everything is revolves around the structure of the bone. So, that being said, when people notice that their nasolabial folds are getting deeper, very often they're concerned about softening those nasolabial folds. And the same thing with the marionette lines. And I'll often ask them, what do these lines really reflect? And what they reflect is volume loss. So when we look at people from a global perspective of bone, muscle, fat, soft tissue, we often, in addition to dealing with the filler and the level of the lines, we also deal with the structure. And we do a procedure called structural volumizing. What this means is the material, such as Juvederm, such as Voluma, is placed directly over the bone structure in a way that is under the muscle and actually provides support that can help compensate for different levels of asymmetry and further enhance the appearance of the nasolabial folds. When you think about it, a lot of very young people have deep nasolabial folds. Why? Because that's the way their structure is, not because of aging. So we do this procedure where we restore cheek volume, jawline volume, and then very often you don't even need something to improve the nasolabial fold because the volume correction has restored balance to the face. When you look at the nasolabial fold, you have to think it's a line, and the skin in this line is relatively thin, and there are deep attachments. So the amount of filler you can place there is subject to the elasticity of the tissue and the ability to really elevate, and there's an upper limit. There's always a limit of how much material you can put under the lines as well as into the dermis, which is the backbone of the skin, which is very, very thin. So learn about this concept of structural volumizing and think about that in the global picture. Basically take a step back and look at your face. Would there be benefit to putting volume in the cheek area? Would that help balance the area out? I've noticed that a lot of times patients will focus on lines and sometimes miss the forest for the trees. And so when we do our evaluations, we actually put their photos up. We have them see what we see as someone who's meeting them, let's say, for the first time and looking at the overall balance. And very often, restoring volume in the critical areas where volume is lost actually balances everything out, and the nasolabial folds don't look as deep as they initially did. So I hope that was helpful. I wish you the best of luck, and thank you for your question.